to cannabis.
Please, we have certain customs and decorum here, so no clapping is allowed.
Notice I didn't say CBD, and that's not a mistake. I use whole plant cannabis. So the question some of you may be asking yourself is, why is she here? People with epilepsy already have access to cannabis. In a way, that is part of my point. If you take away all the labels, product advertisement, trade shows, so-called experts, and tax policies and medical cannabis, then what's left? The answer is patients like me, our families, and our desire for relief, no matter what our condition is. Colorado law already states that cannabis can be recommended as a medicine by doctors. My point is that every patient should have equal access to every medicine our doctor thinks can improve our lives. I should never have better health care than other patients because a politician thinks I should, or because my illness makes me part of some chosen group or class. You've done your part. You've given our doctors legal access to a powerful and safe agriculture-based medicine that almost anyone can safely grow or buy. The rest is, and should be, on us Colorado citizens. Again, I support this bill, but I am asking all of you a bigger question. Do cannabis patients like me have equal liberties and freedoms to you? If so, I'm asking you to help me abolish the qualifying conditions list so our doctors can finally do their jobs and we cannabis patients and our families can focus on our recovery. Thank you.
Thank you for your testimony. Sir, would you like to introduce yourself and then we'll do questions?
My name is Dave Bortell. I'm her father. I'm not testifying. She asked me to come up. If you have a question, I'd be happy to answer it, but I'm just here for her.
Thank you for supporting your daughter today. Committee, any questions? Seeing none, thank you for your testimony. Next, it looks like the bill sponsor has asked for any opposition to come forward.
Yes, Madam Chair.
We have marked not in favor of this bill. It looks like we have Jennifer Hagman, MD. She's not here. I think that's the only one. So let's move right down the line then.
Thank you, Madam Chair.
So we have a Terry Robinette and then also Martha. You guys want to come up together? And then on deck, we have Ben Waters. Yeah, let's get three folks up at the podium there. And Terry Robinette. Okay. Why don't you all introduce yourself and share your testimony, and then we'll open it up for questions.
Okay. I haven't done this in a while. Good morning, or I guess it's afternoon now. My name is Terry Robinette, and I am the Executive Director of Access, Hope, and Cannabis Patients Alliance. And I want to thank you for taking on this important issue, and Senator Marble for bringing this forward to the Senate and later, hopefully, to the House. I've been doing this a lot. This is my 8th legislative session that I've been effectively advocating for patients here at the Capitol and across the state. I was appointed to the Scientific Advisory Council, so I work with a group of doctors and epidemiologists and PhDs on how to spend our research money. I'm also on the Marijuana Education Oversight Committee that works on messaging that's coming out of the state. So I've been doing this a while. I'm here to tell you why I carry this with me, which is naloxone. I carry naloxone everywhere I go. I was trained. That's what this is. This is a single dose of naloxone. A lot of people know it as Narcan. This saves lives. The reason I carry this is because one day the guy that is across the street from us overdosed. My husband Greg went over to visit him, and he was gray. We thought he was dead. The ambulance came and they loaded him up and drove off. No lights, no sirens, nothing. We thought he was dead. We watched all of this going on from across the street from the porch of our house, and I will tell you, I have never, ever felt so helpless in my entire life. Never. So I made it a commitment that I would get trained on how to deliver this important medication. And I don't do this because, for the addict that's shooting up in the corner in the alley, although I would be more than happy to give them an injection if they needed it to save their lives. But the reason I carry this is because I see patients almost every day that are on the brink of overdose from opioids because of their pain level. I want to be able to be there to save their life if they make the mistake of crossing that threshold. And there are a lot of patients that are that close to the lethal dose. And that's the problem with these opioids, is that the effective dose for some people is so close to the lethal dose that one mistake can kill someone. And so I have this, and I carry it everywhere. And thank God I haven't had to use it yet, but I will if I have to. I want to save patients.
Thank you.
And I know that cannabis can bring people away from that threshold. So I'm asking you to please vote yes on this bill, because I have seen people leave opiates behind or reduce their level of intake by using cannabis. So please, thank you for letting me speak today. But you need to pass this bill. It will save lives.
Thank you. Mr. Waters?
Thank you, Madam Chair. Senator Marble. My name is Benjamin Waters. I represent Native Roots, which is the largest dispensary operator in Colorado, with 19 medical and adult use dispensaries across 10 jurisdictions. In the marijuana industry right now, a lot of businesses are operating only adult rec use stores or changing their business models to phase out medical cannabis centers. And while Native Roots remains committed to serving medical cannabis patients, and currently 14 of our 19 dispensaries include medical centers. Native Roots is also among the largest providers of medical cannabis in the state, with more than 4,600 registered patients, in addition to the thousands of additional patients not registered with us that we serve each week. We support Senate Bill 13 as a safer alternative for symptoms relief for patients prescribed opioids for any reasons, and as a means to reduce the enormous negative impact of opioids on Coloradans. With that, good bill, vote yes. Happy to answer any questions.
Thank you. Committee members, any questions? Senator Crowder.
Thank you, Mr. Waters. I'm curious about something. If this bill were to pass and the two physicians would actually get them on the marijuana registry, what would prevent them from going out and getting more opiates?
Waters or Robin? No?
Well, I'm not a physician, and I assume they'd still have to have a physician's prescription to get a prescription for opioids, just as they would to get medical marijuana under this bill.
Right, but
Senator Crowder?
Thank you, Madam. The way I understand this is this actually gets them a marijuana card to get on medical marijuana. Mm-hmm. And your talk about opioids, I understand that. But my question is, if they obtain a marijuana medical card, is there the doctors that give the marijuana card, would they have a record of this so opioids would not be issued on top of the marijuana? I mean, that's what we're trying to do, right? Create a situation where...
Would like to...
Madam Chair, Senator Crowder, I happen to be married to a physician, so I hear about this a lot at home. And they have this database called the PDMP, which shows like who's gotten what sort of drugs when, so people can't like opioid shop around. I don't know necessarily how this would connect with medical marijuana, but I would defer to you. Maybe you might know.
Ms. Robinette?
Thank you, Madam Chair. He's correct that the prescription of opioids is recorded in the PDMP. There's nothing in this bill that would restrict a patient from getting opioids that I've seen. And it, in my personal opinion, that if it did, that would be a mistake. and it would even be a reason to not support it, because there are a lot of patients who need pain medication. There are cancer patients, and what we're seeing now with this rush to reduce opioid prescriptions from physicians, which I think for most people that's a really good thing, but we are finding patients that are dealing with late-stage cancer, et cetera, that are woefully under-medicated, that their pain is not being managed because they can't get the pain medication, the opiate medication that they need. And what we know with cannabis is it works synergistically with opioids so that patients can reduce the amount of opioids that they are taking by using cannabis with that. And we can pull them down back away from that dangerous, lethal threshold where they would overdose and potentially die.
Senator Crowder.
So, thank you, Madam Chair. With what you have just said, would it not be advisable to have that physician have the availability to know that medical marijuana has been prescribed also? So how do you as Mr. Waters indicated, there was a situation where they know the opioids. More than one doctor cannot do that, but the reality is what you're trying to do is get them off opioids. So to decrease that prescription, should that doctor not know that the medical marijuana has been prescribed? Thank you.
Senator Marble.
Thank you, Madam Chair. Senator Crowder, one of the things about this, when a patient goes to see a physician and that physician has prescribed opioids, it doesn't mean that a physician also prescribes marijuana. So the patient has a talk with his physician saying, I would rather try marijuana for pain and be able to have access to that. The physician knows then perhaps those records that the physician has on that patient goes with him to the medical marijuana physician, and that medical marijuana physician has documentation of a previous condition, and he can prescribe the medical marijuana. So it seems very logical in the way this is supposed to work, that tending and primary physician would have that knowledge that medical marijuana is where the patient wants to go to manage his pain.
Senator Crowder.
Well, don't get me wrong, I'm for the bill. Mm-hmm. But the thing about it, if you're going to prescribe medical marijuana and then you're going to prescribe opiates on top of that, according to her, you can. So are we putting, what I'm asking medically, and I don't know if you can answer this, are we putting this person in more medical danger? And that's just a question. And
Senator
if you can't answer, maybe somebody else can.
Yeah.
Senator Marble.
Thank you, Madam Chair. I think it's a really good point for you to make, and it is a possibility. Anything's possible. People have done doctor shopping to get more prescriptions, in access for them. For me, seeing a patient coming who is already on opioids, knowing that the patient would rather go try a marijuana product instead of the opioids, I can't, but like you said, anything's possible. And it happens with prescription shopping and doctor shopping all the time. But honestly, with the people I have met, they want off of opioids so bad. They are having a hard time accessing that alternative to opioids, and that is the marijuana that they can use for pain.
If I may?
Senator Crowder.
It's available to them now.
Senator Marble.
It's available to them now.
What? With a...
Yeah.
Senator Marble.
Thank you. With a prescription, you can prescribe opioids.
Actually, I have, if I may,
Senator
Madam Chair.
Crowder.
I utilize the oil, and I don't have a medical marijuana card.
Senator Marble.
I think what we're talking about mainly is you can access marijuana at the retail store.
Yeah.
What we're talking about is accessing a medical marijuana card so they may get marijuana at a reduced price because the taxes that they... this is... And I thank you for keeping on until we got to what you were really wanting to have answered. And I have to say, I appreciate that very much.
You do?
So if I could summarize, it sounds like someone can be prescribed an opiate and then also obtain cannabis if they wanted to.
All of us.
Senator Marble. Senator Marble.
Okay.
Thank you, Madam Chair. Retail marijuana is available to anyone, recreation-wise, and they could be taking marijuana and having a prescription for opioids, too. That's not what we're talking about, though. We're talking about trying to get a medical marijuana card for a person to manage their pain. And it really, the cost of pain management and anything in the healthcare system is so astronomical that you want to be fair in the way you treat these people. They didn't want cancer. They didn't want maybe to have a car wreck and have the pains that they have. They didn't ask for that, but they don't want opioids as the answer to their pain. They would rather go, and no one has died using medical marijuana, but we have a lot of people who have succumbed to overdose of opioids, and we just want the medical marijuana card available by prescription so that they may access this at a more reasonable price than going
Further
retail.
Questions for these witnesses? Seeing none, thank you for your testimony today.
Thank you, Madam Chair. Thank you, Senator Marble.
Thank you.
So we're just going to go down. Nico, cannot read the writing of your last name. Pinto? Maybe. Mr. Pinto, are you here? Let's go on to Bridget. Bridget is a hyphenated last name.
Bridget? Okay, she's coming.
Okay. Bridget, come forward, and then after Bridget, we'll do William. Shenagos.
Okay, yeah, okay.
Is your mic on? It's really hard to hear. Is William here?
I'm right here.
Okay, have a seat, sir. And then Bridget.
I can use the end. Do you want to? Okay.
Welcome. Who would like to go first? Just please introduce yourself and share your testimony with us today.
Good afternoon. This isn't on.
Is your mic on, sir?
The button. Right. There you go.
Test, okay. Good afternoon. Thanks for having me. My name is William Shengelis. I am a veteran, a Vietnam-era veteran. I'm also chairman of the United States Marijuana Party. I worked for my brother in Ohio for a while back, and I fell off a ladder, and I crippled this hand. And Workman's Comp took care of me in Ohio, and I came back to Colorado to work, and I had to switch from Workman's Comp back to VA. Well, VA is pretty liberal with their narcotics. I was getting 750 Vicodin a month to take care of my hand. Unfortunately, I was an alcoholic too, so I was combining alcohol with the opiates. Eventually, I have cirrhosis now because of it. I've killed my liver basically, but I've been alcohol-free and opiate-free for 2 years. I've been alcohol-free for 1 year, and I did it by using cannabis. I used it for the pain in my hand, the same reason I was taking the Vicodin. And sometimes they would switch doctors, and I would get 1,500 pills a month, and I ate them like candy. I'm lucky to be alive, I guess. I did like 20 a day sometimes. I should be dead, I guess, but I wish you to pass this bill. There's other veterans besides myself that need that help. They're stuck with VA giving them pills. That's what VA does. Thank you very much for your time.
Thank you for your testimony. Bridget, please introduce yourself and share your testimony.
Hi there. My name is Bridget Danderas-Surratt, and I work with Canna Patient Resource Connection. We're a patient charity out of Colorado Springs. Colorado Springs actually has a quarter of the therapeutic cannabis patients in the state. So we've got a very large chunk of them, and many are veterans. I myself have multiple end-stage autoimmune diseases, and if you check your emails, I have sent you a breakdown of what I would take in a year. Having access to cannabis has saved my insurance company over $45,000 every single year, and I take almost 7,000 pills less every single year. It took a long time for me to be able to balance the cannabis and the opiate use and to wean down off the opiates, and I would not have been able to do that if I did not have access to both. My last refill of Opana, which is an oxymorphone, was February of 2014, and my last refill of oxycodone for my bone-eating disease was April of 2014, and my first opiate-free day was May 16th of that year. And I woke up, and I just didn't need the opiates. I'm still in pain. I still have a bone-eating disease, but therapeutic cannabis has saved me so much. Not only that, I'm off disability, and I'm back at work. That's huge. I was in a spot where I couldn't walk more than 200 feet when I moved here from Georgia in 2013. Now I go for hikes for miles. I'm slow. I hobble, but I still hike for miles. So in addition to the cost savings, I've lost 60 pounds and my gut has healed, because when you're on opiates, nothing moves down there at all, and you end up with all sorts of other issues. A lot of my other prescriptions were to combat the side effects of opiates. The cycle of opiates is a painful one, and at first they work, and then they don't, and then you have to up them and up them and up them or change them until you find something that does. And it's misery. No patient wants to be like that. If you want to talk about being high, take a bunch of opiates. Not only that, generally you can't sleep, so they're prescribing Ambien, and being on oxymorphone and something from that family of Ambien, they actually use that in 2-drug lethal injections. And I wanted to close out. I have with me a year's supply of what I used to take. And sunglasses. This is equal to all the pills that I have replaced with cannabis. And I would not have been able to do that if I didn't have access. Severe pain is a qualifying condition, chronic pain and other pains are not. I've also been able to go through multiple surgeries without opiates, which has been phenomenal. I love having choice and freedom. Thank you.
Thank you so very much.
You're welcome.
Senator Smallwood.
Thank you, Madam Chair. Thank you for your testimony. I do have one question for you, because chronic pain is something that's currently on the list of eligibility for medical marijuana. Can you restate for me the condition that you had that was not chronic pain that prohibited you from
Is it chronic pain or severe pain that's on the list? Severe pain.
Senator
Madam Chair,
Smallwood.
if I could. So a chronic condition is
Yes.
the preamble, and then the conditions are listed
Yes.
underneath that, one of which, of course, is severe pain.
I qualify for nausea and spasms.
The way it works is because we have people listening, so I have to introduce who's speaking.
Oh, sorry.
So when I call your name, it's for you to speak, and the same with the senator, just so you know what the decorum is.
Okay.
Senator Smallwood.
Madam Chair, thank you.
Yes.
So if you could restate again, if you had a chronic condition but did not qualify for the severe pain, if you could go into detail for me what the process was of you attempting to acquire medical marijuana with a diagnosis of severe pain that you felt was a chronic condition and why you weren't able to get it before.
Ms. Bridget.
Sorry. I was able to qualify for the card with other things as well.
Thank you, Madam Chair. Thank you.
Thank you. Welcome. Further questions? Seeing none, thank you for your testimony today. Let's see, I'd like to bring up Lori Brown and also Amanda Bent. Okay. And why don't we go ahead and bring up Marcus as well? Marcus, could you please come forward? We're going to try to bring 3 up at a time. So we have Amanda, Lori, and Marcus. And so once you get seated, if you could please introduce yourself, let us know who you're representing, and then share your testimony. Who would like to go first?
I can go first.
Okay. Please introduce yourself.
Hello, my name is Marcus Naheda. I'm a biomedical scientist. I'm here representing Safe Access Colorado. And so ASA works to expand access to medical cannabis for those who need it, and thus supports any legislation that serves a larger patient population through expanding the number of eligible conditions or through removing other barriers to access. According to the National Institute of Health, close to 135 individuals die each day due to opioid-related causes. In Colorado, there were 373 deaths involving prescription opioids and 224 involving heroin in 2017. While this number is lower than some states, it is clear that the state of Colorado needs to significantly decrease preventable overdose deaths. We have seen successes from this campaign in states like Illinois, where Bill SB 336 was signed into law. SB 336 authorizes physicians to offer medical cannabis as an alternative to any patient holding a prescription opioid, painkillers such as Vicodin or Oxycontin. Research has shown that cannabis decreases opioid deaths and reliance on opioids in an analysis of more than 1.3 billion opioid prescriptions from 2011 to 2018. Researchers found that the number of morphine milligram equivalences prescribed each year were reduced by 6.1% in medical cannabis states. In other words, cannabis access laws reduce the average provider's opioid prescription by the equivalent of half a kilogram of morphine. In states with medical cannabis programs, there has been a 25% reduction of overdose deaths, and in a survey of almost 3,000 patients, 93% preferred cannabis to opioids for pain management. I myself am a medical cannabis patient, and I've had trauma from, I used to race automobiles, and I've had some accidents, and so I never used any pain prescriptions because I wasn't able to actually operate in the lab and carry out my work with this type of stuff. Another thing that I also wanted to know, a big study just came out from Nature, which is a prime source of authority in science. They had an interesting thing that they found, which is in Tylenol, pain relief occurs via the CB1 receptor. That's a cannabinoid receptor. The problem is that Tylenol is very harmful for the kidneys and the liver. So 8 can actually kill somebody. So therefore, access to cannabinoids that can actually stimulate these receptors, reducing the harm and toxicity of opioids, would greatly help give physicians a tool set to reduce the opioid crisis.
Thank you for your testimony. Who would like to go next? Either Amanda or Lori.
I would be glad to.
Please introduce yourself.
My name is
And
Lori
who you
Brown,
represent.
and I'm just simply a patient here giving my story in support of this bill.
Okay.
I suffer from epilepsy, lupus, fibromyalgia, pancreatitis, and a host of painful conditions that go along with these diseases. My seizures began at the age of 9, and the health conditions and their painful problems followed years later. I moved from my home state of Georgia in 2014 to take advantage of what I viewed at the time as progressive laws regarding a plant I couldn't access in my home state. I am home. I came looking for a plant to soothe what disease did to my body, and what I found was a home that soothes my soul. This state means something to me. This plant means something to me. I have my life back. Everyone looks at your diagnoses and can have compassion for you dealing with such debilitating diseases. I want people to understand how these medications are diseases within themselves. The box I hold represents the medicines I was on when I crossed your state line. when I was beginning my cannabis therapy, each one of these candies represents a different prescription. There are 11 candies in this box. I have replaced them all with a regimen in form of full-spectrum high-THC cannabis oil and THCA regimen and a variety of natural vitamins and supplements. The pain control alone has restored my life and makes every aspect of dealing with my illnesses easier. I'm more responsible for my health than I've ever been, and I believe it. If I had been provided with a legal pathway to cannabis early in my life and an easy conversation with my doctor about it, I would have been healthier. Please support this bill and make sure patients have access. I did not, and medical professionals have the protection to recommend it to their patients seeking an alternative to opioid therapies who are not riddled with disease. Thank you.
Thank you. Last, would you introduce yourself and who you represent?
Yes, thank you, Madam Chair, members of the committee. My name is Amanda Bent, and I represent Drug Policy Alliance. We are a nonprofit organization advocating drug policies grounded in science, compassion, health, and human rights. And we urge you to vote favorably on this bill, the primary purpose of which is to help curb the overdose crisis in Colorado by fully leveraging the evidence-based harm reduction potential of medical marijuana. The CDC estimates that there are over 50 opioid prescriptions per 100 people in Colorado. In 2017 alone, there were over 1,000 drug overdose deaths, roughly one every 9 hours, more than any other previous year. And these deaths are preventable. Over half of these deaths involve opioids. And we know that the rate of prescription opioid overdose actually increased between 2016 and 2017. So we need to do something about this. Offering Coloradans the option to use medical marijuana in place of opioids or instead of opioids would provide the opportunity to address this overdose issue, prevent overdoses, give folks the opportunity to treat their condition with fewer side effects and less risks. And as previous testimony has mentioned, this is evidence-based. There's a growing body of research that indicates that medical marijuana is clearly a lower risk alternative opioids. It has fewer side effects, helps manage pain symptoms, including acute pain and post-injury pain without the side effects and the overdose risk. It lowers the likelihood of withdrawal symptoms, which are very problematic. There's no risk of overdose, I think I've already said, much lower risk of addiction. It's effective. And I'm sorry that Senator Crowder stepped away because all of this evidence gets to the point that when medical marijuana is available, it's not as if we see the floodgates of opiate prescriptions go up. In fact, the evidence shows the opposite. There's less use of opiates or opioids when medical marijuana is available. And so in order to really just leverage that with this harm reduction mentality that we urgently need, we can offer it to folks so they never have to touch opioids at all. That would be the goal for some people, to avoid opioids altogether, or to minimize their use and reduce their use over time, as has already been mentioned. So I thank you for your consideration and, again, urge you to vote in favor of this bill.
Thank you. Committee members, are there any questions? Seeing none, thank you for sharing your testimony today. Next up, I would like to bring up Amanda Wayne, Jennifer Axel, and Mimi Friedman. Let's see, who are we missing? Okay. So Amber is not here? Amber, will you come forward? Yes. Because we have Amber, we have Jennifer, and Mimi, right? Okay.
Yeah.
Thank you. Will you please introduce yourself and who you represent, and then share your testimony with us today?
Oh, me first?
Sure.
Oh, okay. My name is Mimi Friedman, and I'm here with American Medical Refugees, and I'm a refugee cannabis patient. I was dying in Ohio of a whole bunch of GI diseases that I'm not going to go into detail about in 3 minutes, but my point is that the original injury was a car accident on New Year's Eve of 2002. I was previously a healthy kid growing up, and after my car accident, I was put on 120 painkillers and 120 muscle relaxers a month immediately. And I took those pills for a few years.
Senator Smallwood.
I want to be respectful to your time, but I can't hear you at all.
Oh.
So I want to be able to hear what you're saying. So I want to make sure your microphone is on, and if it is, if you could get closer to it, because I haven't been able to hear anything yet.
Okay, yeah, it's on. Okay. Okay, so should I start over?
I would appreciate it.
Sure.
Okay.
We'll restart the timer.
Okay, my name is Mimi Friedman, and I'm here with American Medical Refugees. I'm a refugee cannabis patient, which means I can't stay alive without the plant, for a host of GI diseases. And my original injury was a car accident on New Year's Eve 2002. I was rear-ended at 50 miles an hour at a red light in the rain on New Year's Eve. And I was only 19 years old and didn't know what to do, so I went into pain management therapy, and they immediately put me on 120 painkillers and 120 muscle relaxers per month. And this was just to start out. I started on Vicodin and then moved to oxycodone, and then I switched back and forth between roxycodone and Lortab for almost 5 years. And I was in severe pain, and even with the medication, it wasn't helping that much, and I was not that mobile. I went from being a healthy teenager to lying in bed all day. And then about 3 years after I went into pain management therapy, that's when I started developing bleeding ulcers. And I went to the emergency room for that a few times, and I was eventually just diagnosed with peptic ulcer disease, which means that you don't even have to have the H. pylori bacteria. Your stomach lining basically just rips itself apart. And I really want to talk about the role the drugs had in that progression of my GI tract. It got worse from there, and these pills are known to cause those side effects. Now I can't take any painkillers because it tears up my GI tract too much. And so the hospitals, in still needing to treat my pain but not having access to cannabis, switched me to IV medications. And I was on Dilaudid, morphine, pretty much everything, every painkiller that's out there, IV, I was on it, plus 50 milligrams of IV Benadryl every 4 hours around the clock just to combat nausea symptoms from my GI tract diseases. So I just want to say that if I had been given access to cannabis when I had first gotten into my car accident, I may never have gotten sick, because these pills are what made me sick. These pills are what took my life away. And if I had been given access to cannabis, who knows what I could do right now. And I just think that everyone should have that opportunity to have that choice of cannabis instead of pills that we know are dangerous, that we know cause problems, that we know have overdose rates that are skyrocketing. Why wouldn't we use a safer alternative right off the bat? So,
thank you. Yep. Next, will you please introduce yourself and who you represent?
My name is Jennifer Axel, and I just represent myself as a patient. What I want to speak to is quality of life of being an opioid patient versus a medical cannabis patient. I was in a near-fatal car accident 10 years ago, and ultimately that took so much away from me because of the pain it gave me. What I didn't realize, though, all the opiates that I got put on took so much more from me. My memories, the accident happened 3 months before I got married, and I don't remember the ceremony. I don't remember my honeymoon. We went to Paris, and I spent 3 days of that in bed in the hotel on all of these opiates that were supposed to be making me better. And the memories for years, I spent the better part of 5 years in bed on these pills that were supposed to make me better, and they didn't. There was nothing better in my life. By comparison to where I am now, I am off 13 different opiates and narcotics, and I am pain-free using just cannabis. And while I still have all of the damage that initial car accident did to me, I'm no longer in pain. And I'm now dedicating my professional life, because I can finally work again for the first time in 10 years, to helping other patients have easy access to cannabis, to hopefully, like I didn't have the option, the same sentiment she said. If cannabis had been offered to me from the get-go, I never would have gone down the path of years and 7 years of addiction to pain pills. I wouldn't have even started that with all the other side effects that come with it. I wish I had never started, and it just wasn't an option for me. And I want to help change that. Thank you.
Thank you. Please introduce yourself and who you represent and share your testimony.
Thank you. Thank you, Madam Chair and Committee. My name is Amber Wan. I am with Safe Access Colorado, but I do represent myself today and redheads everywhere. And I do ask you to support SB 13. You might ask why I speak for all redheads. Well, if you Google redheads and pain, you will find a plethora of studies associated with this topic. The Journal of Medical Genetics speaks about the MC1R gene that not only gives redheads their red hair pigment, lighter skin color, and freckles, but it also is responsible for the midbrain function that determines pain response. Dr. Shaw at UCI Health is a pain management specialist and states that classic anesthesia literature has documented that redheads require more anesthesia, while recent evidence shows that the redheads, though more tolerant to local anesthetics, are more sensitive to opioids. For redheads, it depends on the pain. We are known as having a higher pain tolerance, and I can tell you, after giving birth to 4 children, and 2 of which are twins, naturally without any form of pain medication, I do have a high pain tolerance. But yet, in 2010, working as a flight attendant, and I tore 2 discs in my lower back after the aircraft I was working on hit turbulence. My L5-S1 disc was badly damaged, and at 35 years old, I had instant extreme osteoarthritis, which with relentless knife-stabbing pains. I was told that I was too young for a fusion in my back, and they doped me up on pain medications that didn't work for me. I sunk into a depression for nearly 3 years, being strung through the work comp system and prescribed antidepressants on top of it, which I could not function on. I began to drink alcohol more and more and to help my pain and drown my sorrows, but that did not work either. I would eventually get my spinal fusion in 2013, and though it was easier to quit opioids for me, drinking alcohol continued. An article in 2013 in the Science magazine mentions how copa opioids work better for redheaded women, but upon further research in 2016 in a PubMed article, opioids are traditionally associated with pain, analgesia, and drug abuse. It is now clear that opioids are a central player in mood. This includes major depressive disorder. Fast forward, I have had arthroscopic hip surgery. I'm facing 2 hip replacements in the future. I do deal with pain on a regular basis, but I refuse to go down that opioid rabbit hole anymore. And I slowly started incorporating cannabis successfully into my pain management routine. And I have quit drinking alcohol for 2 years now. And despite the chronic pain, I am not depressed thanks to cannabis. Just to wrap up, what I mostly want to convey is that redheaded or not, no one really knows why people respond to certain substances differently amongst all different subtypes. But doctors prescribe off-label pharmaceuticals to patients every day, practicing a guessing game, not always based on scientific evidence. And so I just want to thank you for your consideration for this bill. Thank you.
Thank you for your testimony today. Thank you.
Thanks.
Any questions?
Any questions from the committee members? Seeing none.
Okay, can I make one more quick statement really quick? I just wanted to say that pain management doctors in Colorado do drug test their patients, and if you're on cannabis, they'll know about it, and they won't prescribe opiates on top of cannabis right now. That's how the system's set up at the moment. Hopefully we can change that because, as Terry said, there are a lot of patients that have pain that's not adequately managed by either pills or cannabis, and a lot of times they do need both.
Thank you. So next up, I'd like to bring up Samantha Pock, Madeline Rogers, and Julie Richardson.
Madeline or Melanie?
Madeline? And Maylene Rogers? Denver? Melanie, come forward. Melanie Rose? Is that you?
Okay.
Samantha and Julie. Welcome. Please introduce yourself, who you represent, and then share your testimony with us.
My name is Samantha Prock. I'm representing myself and my husband. 4 years ago, me and my husband decided to move to Colorado for medical cannabis from Texas. I was diagnosed with fibromyalgia, subacute cutaneous lupus, costochondritis, hypothyroidism, and arthritis. My husband also has pretty bad scoliosis that causes him severe back pain every day. Together we were on a total of 16 pills every day. And through medical cannabis, we've been able to get off all of those pills because it works significantly well for chronic pain and inflammation. I would just like to thank all of you for listening to all of our testimonies today. And please support the bill. Thank you.
Thank you for sharing your story.
Hi. Thank you, Madam Chair. My name is Melanie Rose Rogers. I am representing myself today, as well as founding chair of Safe Access Colorado. We're a new lead chapter here of Americans for Safe Access. Americans for Safe Access, like Marcus had mentioned, has been around since 2002, and they have been advocating for medical marijuana access for patients and therapeutic use and research. I'm here really to just ask in your support of this bill. You know, it has been proven time and again that states that have a legalized program are seeing a decrease in opioid deaths. I am in my mid-30s, and I've lost so many people to overdose to opioids that it has fueled my passion for being a cannabis advocate. Addiction holds no prejudice. It happens in the most well-respected families and towns, and it could start with just as a prescription of, you know, you being in a car accident or a bicycle accident. And so it's even reached the point of my extended family, and cannabis has helped someone there wean off their opiate use. So I'm just begging you, as someone who sees so many young people of my age, to really vote in favor of this bill to provide access so that people like myself, like I already know, I won't use opioids ever if I can, because I know the high rates. There's even a new study now in Colorado that you can die from an overdose than actually more than death of an automobile accident. I mean, it is something that addresses the youth of my time and my age, and I just really ask in favor. And I also sent you all an email with some certain research from National Americans for Safe Access, citing research and citing some other things that they've done across the nation to help with this opioid epidemic. Thank you.
Thank you. Please introduce yourself, who you represent, and share your testimony.
Good morning. My name is, afternoon. My name is Julie Richardson, and I am a member, board member, supporter of many of the organizations here, but also employed by VEDVERX, which is a CBD company. My qualifying conditions as a patient is cancer, epilepsy, stroke, brittle bone disease, scoliosis, degenerative bone disease, PTSD, and just for fun, peripheral polyneuropathy. I went down a flight of stairs as a baby in a walker, and this caused every vertebrae to be slightly off. From that, I developed arthritis at 13 and had, I don't know, a day without pain. The beauty of moving to Colorado and being able to be a cannabis patient, I was able to replace all of my medications. And as of last week, my neurologist very happily wrote, continue with your cannabis oil. You no longer need medications. That's huge. Huge. But when it comes to pain, the beautiful thing about cannabis is it also helps with inflammation. 2 years ago, I had a flare. And it was cannabis that I was able to take every 6 hours to get it under control instead of every 6 hours an opioid. Within a few weeks, I was taking care of myself again. Within a few months, I was out of my wheelchair. And today I dance. So please support this bill.
Thanks for sharing your testimony. Committee, any questions for these folks? Senator Smallwood.
Thank you, Madam Chair. And this is probably more of an open comment to anybody who will also be testifying afterwards. What I'm curious, as I hear testifiers talk about the chronic conditions that they have and their ability to already receive medical marijuana and how it's benefited them, but obviously, with this bill, we're talking about primarily acute pain because chronic pain is already covered. So it would be beneficial for me if either anybody on the panel here or future panelists that come up might be able to emphasize instead if they have examples personally of denials of being able to receive medical marijuana on the basis that the current definition does not satisfy what they're looking for.
Please
I think
respond.
I can help. Julie Richardson. When you first are injured or when I'm having a first part of my flares, if you can hit that hard with cannabis and get that inflammation under control, then you're not going to elevate to the point where you do need an opioid. You'll keep it kind of like what you would maybe say in the Advil state, and it never progresses, or it shouldn't. And that's how it's happened with me. You know, I'll start on these little journeys and it'll stop it in its tracks.
Thank you, Ms. Richardson. Thank you all for your testimony today. Thank you. Okay. So let's bring up John Gray and Roderick. And let's see, Vicky Trujillo. Roderick, John, and Vicky. Welcome. Please introduce yourself, who you represent, and then share your testimony.
I'm Dr. Roderick Gatula, representing myself.
Okay.
I want to speak in favor of this bill. I am a board-certified family physician for over 40 years. I have been certified in hospice and palliative medicine for over 12 years. And in that role as a hospice physician, I've become very well acquainted with the use of opioids in my patients and the side effects and downsides of it. And I'd like to talk a little bit about the science and safety of cannabis. I am a proud cannabis physician practicing in the Springs. There's a website called PubMed that is sponsored by the National Institute of Health, and it's a repository for all sorts of medical articles that have been published for years and years and years. If you go to the search bar and you type in cannabis, medical marijuana, medical cannabis, you will get 45,000 plus citations of papers that have been published regarding medical marijuana. If you put in oxycodone, you're going to get 3,400 citations for oxycodone, which is the ingredient in OxyContin. If you put in hydrocodone, which is the ingredient in Vicodin or Nocor, which is commonly used, you'll get 1,103 citations. So when people talk about there not being any research out there, I don't believe it. It's out there. It may not be as much in the United States because it's illegal here, but Israel, Canada, New Zealand, et cetera, have all been doing research on this for years. There's never been, and it's been stated before, there's never been a documented death from overdose of medical marijuana. Theoretically, you could overdose on it. The overdose amount is 1,500 pounds ingested within 15 minutes, or 20,000 to 40,000 joints smoked within 15 minutes. But otherwise, from a safety standpoint, it can't even compare to what the overdose of opioids are. So how does this play out? I have a clinic in the Springs, and I see people every time I have a clinic who've had chronic pain. And what they use this for, they come to me for a card, what they use it for is to go ahead and reduce their pain. They may not get off opioids, but I have patients over and over and over who do get off opioids by using medical cannabis, and I have patients who markedly reduce their use of opioids using medical cannabis. It was asked earlier, I think, Madam Chair, you asked about whether or not this really helps for pain, and there is absolutely no doubt that this works for pain. So this bill, as I understand it, would provide medical marijuana certification to individuals with painful conditions and help keep them from running the risk of addiction. So you can become addicted to an opioid anywhere from a week to 2 weeks of using it. I think Senator Smallwood asked about how this would help. When you have somebody that has a painful condition, say they have a fracture, they've herniated a disc or whatever, as the opioid laws have changed, they're kind of limited, physicians, to giving maybe a week or 2 weeks of opioids.
Doctor, I'm going to need you to wrap up.
Okay. So I'll be glad to answer questions, but please support.
Thank you. Senator Smallwood.
Thank you, Madam Chair. Thank you, Doctor. So I'd like for you to complete that thought, if you could.
So if I have somebody coming to me who says they're in week 3 or 4 of having a herniated disc and they can't get opioids anymore, this is a way for them to get pain relief without having to go to opioids. I understand of the opioid crisis and the reason for cutting back on opioids, but what do you do for those individuals who are sort of caught in the gap?
Senator Smallwood.
Thank you, Madam Chair. Thank you again, Doctor. And I'll remind you also to go through the chair, just because there's millions listening at home that want to know who you are.
Okay.
So where, medically speaking, is the line between acute care and chronic care in the example you just gave?
Doctor?
I'm not sure I understand. So one of the if I had somebody come to me, say that it was in 3 to 4 weeks and they're still having a lot of pain, under this bill, as I understand it, I would be able to go ahead and give them a medical marijuana certification.
Senator Smallwood.
Thank you, Madam Chair. So, and apologize for cutting you off potentially, but under rules, severe pain is already a condition on a chronic basis for you to do exactly that. So either what you're describing and where I'm looking for your help is, without a change in definition, would you be unable to recommend that today because either A, the pain isn't severe, or B, it's not considered a chronic condition?
Doctor?
Thank you. My understanding is that it has to be significant pain that's chronic the way it is now. Although it says severe pain, almost everybody that I see is somebody who's had it for quite a while. So I think the difference is that I would be able to intervene with the certification earlier than I do now.
Senator Smallwood.
Thank you, Madam Chair. And I apologize if I'm being redundant on this, but somewhere, medically speaking, there has to be a line between an acute condition and a chronic condition, because you're going to have severe pain that's an acute condition, you're going to have severe pain that's a chronic condition. Medically speaking, if you could let us know where that line is today.
Doctor?
I don't think you can give a specific line. I mean, when we look at pain, most of you are familiar with our saying, okay, on a scale of 0 to 10, what's the pain? So I have a hard time differentiating between somebody that has a 4 out of 10, but it's there for 3 months, versus somebody that has an 8 or 9 out of 10, but it's been there for 3 weeks.
Further questions of this witness? Please introduce yourself and who you represent. Thank you, Doctor.
Good afternoon. My name's John Gray, and thank you for the opportunity to speak here. This bill, to me, is common sense, which is why I support it. Because as it has been stated before, there are no deaths on record as a result of using cannabis. The doctor used the example of a 1,500 pounds in 15 minutes. I suspect the only way you could have that happen is if a bale of it fell on you and killed you. My daughter was in the Navy. She joined about 3 years ago. She had career aspirations of staying in there 20 years. After being sexually assaulted and being slipped a roofie one night out at the club, she woke up on the floor of her barracks floor, unconscious, not knowing what had happened the night before. Her roommate reported it. After multiple Navy facilities and 11 prescriptions later, at which point she had not had one prescription prior to joining the Navy, she promptly gained 70 pounds and went through 4 different surgical procedures to remove fatty lipomas that developed as a result of the opioids and other assorted prescriptions she was given. She's since gotten out of the Navy, and in the last 3 months that she's been home with us, we've been able to wean her off of all 11 prescriptions that she had, and she now enjoys some degree of normalcy in her life thanks to cannabis. The one thing I think that people are missing here is that if you start taking cannabis and you decide it doesn't work for you, you can cut it immediately with it. You don't have to be weaned off it like pharmaceuticals. You can stop it immediately with no side effects. So I guess I really don't get how there could be any question about supporting a bill in which the deaths from cannabis compared to the deaths from opioids, I just don't get how that's a hard decision to make, because it's inconceivable to me. Anyway, I support this bill. I hope you will too, and I hope for my daughter's sake. Senator Smallwood, you asked if anybody had ever been declined as a result of pain. Well, when my daughter was in the Navy, she was declined because she requested SATIVA, which is a prescription synthetic cannabis made by GW Pharmaceuticals. It was an over-the-counter drug. She was denied that. My daughter has fibromyalgia and traumatic brain injury. Since we have weaned her off her pharmaceuticals, she's shown great improvement in her day-to-day life. So thank you for your time. I appreciate it.
Thank you, sir. Please introduce yourself, who you represent, and then share your testimony.
My name is Vicky Trujillo. I represent myself, and I'm also with Safe Access Colorado. Those that know me know I've always been here to fight for the kids and my son. My son is a cannabis patient. In 2007, I was 27 years old. I got injured at work. I have messed up my L4, L5, and S1. Through the years, I ended up with sciatic nerve damage to my left side, a flat back. Right now, you could tell I am uncomfortable because I've been here since this morning and I've been sitting a lot. Being on the medications that they were giving me through the journey, I do have a liver disease. I'm finally getting my levels down. I gained dramatically a lot of weight. Back in May, I weighed 205 pounds at 4'11", my height. Now I'm at 188. Starting my son off on cannabis in 2017, I had to wing him off all his meds. He due to the fact of him being on so many, he has lost his hair. He was underweight. He wasn't eating. And now my son is at 79 pounds and barely 13 years old. I also got diagnosed barely last year with seizures from my diabetes. And so me seeing the greatness of it doing to my son, I tried CBD. And to not my knowledge of just trying to work on a seizure coming that I could feel, like I don't have them crazy, but just me knowing what it is of shifting, I noticed that I felt that the nerves in my feet stop and my back, the inflammation went down. Being on all the medication they gave me through work comp, they do test you for any other drugs like weed or whatever, but I never did any of that. After a while, I did become an alcoholic for two years, and I'm not proud of that because I'm a mother first. A lot of people didn't know that about me here until today. Being a person that has a child that is on cannabis and I'm over here fighting my pain myself, I've been quiet. But knowing that I have that option to get the CBD, not because of my seizures, I seen the difference. Before I used to be like, I just want ibuprofen 800, don't give me nothing else, because I know what it did to my body. I have a liver disease. I have to do upper and lower GIs every year now to see how badly my intestines are. It takes me close to 30 minutes to use the bathroom because I messed up my tracking because of the medication. And I just want you to support this bill because, like I say, it does work. I can't say it any other way. For my son, for myself, I noticed my son is also PTSD, and because he's on cannabis for spasms, and I shared it with everyone today, Christmas was the first year of being a trigger for him that he did not act out in any way of any kind of post-traumatic stress at all. And I have to thank cannabis for that. And I just want to thank you and ask that you guys support this bill.
Thank you so very much for sharing your story with us today. Committee members, are there any questions? Seeing none, Senator Faith Winders.
I just want to say a quick statement to you, to everyone that has come today and shared your deeply personal stories about your experience with medication, your experience with pain, your experience with cannabis. It takes a lot of courage, and I appreciate it. And thank you for bringing your courage into this room.
Thank you.
Thank you. Thank you again for being here. Next up, I'd like to bring up Jacqueline Rose, Henry Lawrence, and let's see, Jennifer Hagman. Welcome. Please introduce yourself, who you represent, and then share your testimony with us. Who would like to go first?
My name is Jackie. Can you hear me? Thank you.
Ms. Rose?
Thank you. Forgive me, I'm a little nervous. I've never done this. So my name is Jackie Rose Wiest, and I represent myself and my loved ones and everybody who is suffering from any kind of chronic pain or acute pain and can benefit from cannabis. I have lost people to opiates, both black market heroin and over-the-counter prescriptions. I am a medical marijuana caregiver. I grow organically in my home. My patient is a family member who has suffered from chronic pain for a very long time and is weaning herself off of opiates. So I'm speaking from personal experience. I'm watching the benefit. I'd like to share with you a little bit that I do know. Every human being has what is known as the endocannabinoid system. This system is inside of our bodies. It utilizes cannabinoids that we create inside of our body, as well as cannabinoids that we take from plant medicines around us. So this is a very important fact that I feel every politician involved in marijuana needs to understand. Cannabis is indeed a supplement. It is indeed a nutrient, and that is why it works so well for every condition that we have studied. I would like to also add that in Jerusalem, they have done extensive studies with withdrawal symptoms. They have found that cannabis can actually erase the neural pathway that is the payoff in the brain for addiction. So what we know then is that if we get our people who are addicted to anything, opiate or otherwise, alcohol included, if we get them on cannabis, it withers or erases or severely reduces the withdrawal symptoms. So we know withdrawal symptoms are very heavy. They are the cause for rebound, why most addicts and alcoholics go back to the drugs or the alcohol. So if we know through scientific study in Israel that it reduces withdrawals, then we have a greater success of saving people who are working to get off of opiates. Chairwoman, I am your constituent, and I'm so excited to meet you in person. I live in Aurora, and I'm very hopeful that you will all support this bill. It is very close to my heart. Senator Smallwood, you have had some amazing questions all day, and I would love to just address a couple things that I heard you say. Yes, we do have medical marijuana for people with pain. Yes, we do have recreational. Senator Rodriguez, I heard you say that we can buy recreational. It's available. Why do we need to change these laws? Well, the recreational is only available to people above 21. And you're not allowed to share it. It's actually technically you're not supposed to give it to anybody else. So you can't buy it for a loved one who's underage because that's illegal. If your doctor says that your pain it doesn't qualify under current laws, then you will be denied. And that means all the people who are going to get into a car accident today or tomorrow, because car accidents happen every single day, and that is acute pain.
We're going to need you to wrap up, please.
I think I'm done, but thank you for your time.
Thank you for sharing your story and your testimony. Please introduce yourself and who you represent.
Want me to go ahead and go?
Yes,
okay.
please.
Thank you, Madam Chairwoman and members of the committee. My name is Dr. Jennifer Hagman. I am a physician and board certified in general psychiatry and child and adolescent psychiatry. Today I'm representing the Colorado Psychiatric Society, the Colorado Child and Adolescent Psychiatric Society, the Colorado Medical Society, and the Colorado chapter of the Academy of Pediatrics. I've been in practice here since 1993. The opiate crisis, as you've heard, is a very serious problem, and Colorado is taking bold steps to address prevention, diversion, and treatment. Although very well intended, we do not believe this bill in its current form is part of the solution. We have serious concerns about issues of how this would be implemented, especially the risk associated with someone receiving a 1-year red card for any condition for which a physician could prescribe an opiate. The concern about giving someone a full year certificate for a pain situation where only a few days or maybe a few weeks of pain medication might otherwise be dispensed, I think is a really significant issue. Once an individual receives a red card, there are no limits or recommendations from physicians related to what products they select or how they use them. We're also concerned about children in this bill, and there's a proposal to significantly change the language, eliminating the involvement of a physician who knows the child and is involved in their care. We do have a collaborative work group that started meeting yesterday to address this concern, and I am cautiously optimistic that we may have some progress in that area. But currently removing a physician actively involved in the care of the child, I think, is a very significant problem. Marijuana is not a benign substance. As a child psychiatrist, I see several kids a month who require admission to an inpatient psychiatric unit for the onset of psychosis, which can be quite severe and associated with the use of marijuana. I see many kids who are using marijuana regularly and present with severe depression, loss of interest, and social withdrawal. Yes, there are some benefits to cannabis and marijuana. I think that's becoming clearer. There are also significant issues with substance abuse, and we have no way of predicting which individuals are more vulnerable to the adverse outcomes of marijuana. So I urge you to consider different options for approaching this, looking at limitations on the length of time a red card or certification is received. It's not a prescription. It's just a certification, and right now it's for a full year. Thank you.
Doctor, you mentioned this working group. Can you elaborate a little bit more about what thoughts or ideas that you have?
Yes, Madam Chair, thank you. Thank you. So yesterday, this was related to the autism marijuana bill that was heard earlier in the week, and similarly, there were quite a few concerns expressed by our group about the impact on removing anyone with familiarity with the child involved primarily in their medical home from the process of the certification or the diagnosing. And so it was a very productive group pulled together on the House side with Representative Hooten, Representative Singer, a large coalition of folks from both sides of this discussion, and talking through the barriers to physicians being able to provide certifications, and there are quite a few. I think that's important to address, and different ways to still find a meaningful way to allow access for children without putting undue barriers, but also providing some protection, safety, follow-up ability for the physician involved in their medical home care to monitor and make sure things are going well.
Thank you, Doctor. So what you're saying, the way the bill is written with only two physicians, those two physicians don't necessarily have to be physicians that's currently treating the child. That can be any physician.
That's correct, Madam Chair, and they also are not required to be physicians with expertise in the care of children and adolescents.
Okay. And my final question, then I'll open it up for other committee members. What pain would not qualify for an opiate?
I can answer, Madam Chair.
Yes.
Well, it seems to me that as currently written, severe pain is a pretty broad category, and chronic doesn't really have a definition either. So that's one of the challenges with the acute pain in the full year with the red card. So it can be interpreted different ways by different physicians.
Senator Crowder.
Thank you, Madam. My curiosity, did your group have a discussion on children under the age of either 18 or 21 about just CBD oil and salve? I guess what I'm looking for is, maybe the sponsor would like to add also on to this, but are we talking about smoking weed under 21 or 18 for this bill, or are we talking just oil and salve?
Thank you, Madam Chair. There's no ability to specify when you're doing the certification based on the diagnosis for CBD or THC or joints or tinctures. There's none of that occurs.
So
Senator Crowder.
Thank you. Am I correct to understand the bill opens it up for every type of marijuana use, whether it be weed or oil or salve? And are we talking about that opens it up for children 7 and 8 years old?
Dr. Habron?
Thank you, Madam Chair. Yes, that's correct. When an individual or a parent, if it's a child, goes into a medical marijuana dispensary, they're free to select any product they want.
Senator Crowder.
To the sponsor, I guess, is that the intent of the bill, to have children 7, 8, and 9 smoke marijuana?
Senator Marble.
Thank you, Madam Chair. When you talk about wanting more discussion on this, or, and I know an amendment may be in the works, and I have been apprised of that amendment, to which I have no disagreement. But when you look at children, the poisoning deaths for various drugs, over 9,000 children and adolescents died from opioid poisonings, and that is since 1999. And I'm just, it's not just prescription opioids, but we're looking at the heroin deaths are almost 12,000. Benzodiazepines, we're looking at a very unsettling mortality rate. Cocaine, antidepressants, Tylenol. There are deaths recorded for all of these, yet none for cannabis used. Are you going to go to bat and protect children from these other types of pharmaceuticals?
Senator Marble, I think the question that Senator Crowder mentioned does not refer to overdose, but the question was about access, that having a child have access to cannabis with a physician that has no prior history or knowledge about the child's condition.
Right.
Is that right, Senator Crowder?
No, ma'am.
Yeah, we can't hear. We can't hear anything, and I'm so sorry.
All right. The question was, what we're talking about, and it just kind of drifted in, but are we talking about a 7 or 8 or 9-year-old smoking marijuana, or are we talking about? Well, what I'm getting at is if the certificate is to open it up for marijuana use, should there not be a restriction on that certificate for certain types of cannabis, such as the oil, such as the salve, but not smokable marijuana for a 7 or 8-year-old? That was the question.
Senator Janal.
Thank you, Madam Chair. And Senator Crowder, I believe you're right that this was not intended for a child to be smoking marijuana. I mean, there are other ways of taking the product, and it would be tinctures or in food or some other way.
So, with that said, Madam, you would
Crowder.
be open to amendments to that effect?
Senator Janal.
Thank you, Madam Chair. Senator Crowder, I believe that we could look into that.
Okay.
I don't know what's already happening. Doctor, you had said that there were meetings underway, so I'm not sure what is happening, and maybe you were part of that and can share that.
Dr. Hagman.
Thank you, Madam Chair. That was not discussed, but that would make a significant difference.
Well,
Senator Crowder.
Thank you, Madam. I think you ought to be thinking about, I like the bill, but I don't like 7 or 8-year-olds smoking marijuana. But I thought, because I was thinking more of the oils and the salves, which makes more sense. So thank you for that.
May I speak to that? Just a comment as a parent. I have 2
Please
children.
introduce yourself. And
My
we'll
name
let
is
you
Jacqueline Rose Wiest, and I would just like to add, Senator Crowder, that it would be up to the caregiver's discretion, which would be the parent or the legal guardian. And my children are very healthy and do not require any medical marijuana or anything, thank God. However, if they did, I would give them the oils, like you say. I wouldn't want to see my child inhaling or combusting, as we know that that's actually not the best way to get your medicine.
Senator Crowder.
Yes, thank you, Matt. That was my point.
Yeah,
Thank you.
I heard you loud
Okay.
and clear.
Thank you.
Thank you.
We're ready for
Chairwoman.
you to introduce yourself and share your testimony
First,
and who you represent.
Going back as a comment, basically I'm sorry, my name is Sonny Lawrence. I'm Colorado's newest lobbyist. I represent over a dozen groups and 60,000 people nationwide. In a comment to what your question was, the new CBD oils, lotions, etc. are made from hemp. Hemp is cheaper for the private sector that are producing it to use than the quality that they use in the stores, medical grade, that the of-age adults can use in smoking. Madam Chairperson, if I may, I'll start. My name is Sonny Lawrence. I am a CPP, chronic pain patient, have been since 1983. I am really favorable to this bill that you're working on. Out of the 60,000 people that I represent, I have seen more people here today that have been helped with the use of marijuana. Anybody that can get some kind of result to where they're not doing pain medication, I think it's fantastic. But again, the propaganda and misinformation, they keep saying opiate deaths. Opiate, if you changed it to what it really is, it's heroin/fentanyl. More people are overdosing on heroin, not opiate medications. Out of 60,000 opiate patients, there's not one that has overdosed on their medication. If they're going to commit suicide, they're going to do it with the bullet, because the last thing they want to do is have their name go down as a statistic as dying from suicide using opiates. So, with the propaganda, misinformation, that's it. One of the problems that I have come across, because I have been searching for a chronic pain doctor, board certified, when I'm in the Boulder area, they are pro marijuana. Try the oils, the lotions, etc. When I get out to Denver Tech Center, Greenwood Village, the upscale, anesthesiologist, because the federal government, and this gives me another point I want to get across, the federal government does not recognize marijuana as being legal. They kind of turn a blind eye because a lot of states are receiving tax money, and it's good for the individual states. But I've seen it in the past to where, as in the state of Colorado, because they pass a bill, the federal government all of a sudden says, hey, listen, that's not good. We don't recognize it, so we're going to hold back $2.5 billion out of your annual budget for your roads and bridges.
Mr. Lawrence, I'm going to need you to wrap up.
Okay. I could go on for an hour. I think the CBD oils are great for epilepsy in the younger children, 2.5 years old. They have 20 episodes a day, and they stop immediately. So I'm really pro marijuana. The cost. For me to go see a doctor to get
sorry,
my I'm
Mr.
looking
Lawrence,
for my red
your time
light.
is
It hasn't
up.
gone off yet. 27 seconds. Okay.
No, she reset
it cost me $250 to see a doctor, another
that means that
$100
you're
to get
over
my
your
card.
time. So at this point, we have you down as Henry Lawrence. Are you Henry or is it
Henry
Sonny?
Lawrence, yes. My nickname's Sonny. I've been Sonny
Okay.
for
We just want to make sure we have
63 years.
the name right.
So my legal name is Henry Franklin Lawrence IV. My grandfather was a senator and a congressman.
Let's see if there's any questions for you, Mr.
If there's any
Lawrence.
questions, I've got a
committee member
fact-checked,
Are there any
up-to-date
questions
numbers.
for this, for any of the folks that are testifying here today? Any questions? Seeing none, thank you for sharing your testimony today.
Thank you.
Thank you,
Thank you so
Madam
much.
Chairman. Person.
Yes.
I could
So
go on for an
next
hour.
we have up. Let's get Kenny up here. Kenny Breeden, Kathy Peterson, and Mindy.
Yeah, I did. I'm not on that list because I just signed up afterwards.
Thank you for being here today. Sean, did you want to? We're going to need you to. I just called up
It's
three.
over there.
Okay. Okay. So why don't you introduce yourself, who you're representing, and then share your testimony. And if you haven't signed the sheet, we're going to need you to sign up. It's another sheet over there. Okay. Who would like to start?
I will.
Okay.
Good afternoon. I want to thank the committee for hearing us this afternoon. My name is Kenny Breeding, and I'm representing myself. I am a medical marijuana refugee from the state of Tennessee as of 3 years ago. I fully support this bill, and I'm asking that you do too, for the very reason that this journey started for me about 26 years ago when I took my 3- and 5-year-old sons roller skating and was involved in a accident on the floor that resulted in the breaking of 5 bones in my foot, ankle, and leg. That was taken care of, but at the same injury, there was complications from what's called compartment syndrome. Basically, your calf is a capsule of muscles with blood vessels working its way down to the leg, to the foot. The calf had hit so hard that it had busted the blood vessels inside the calf and had nowhere to go. As a result, to relieve the pressure, there was 4 incisions made in my calf to relieve the pressure. During this time, to fix the fractures, there was a cast over the bandages and over the wounds. Once the cast came off, it was discovered that 3 of the wounds had healed from the inside out as it was supposed to. 1 never had. I endured this for 26 years, in and out, in and out, in and out of surgeries, infections, complications. That resulted the last year that I was in Tennessee, I was in Vanderbilt Hospital, one of the best hospitals in the country, 4 different times that fall. First time I was in for a week, second time for a matter of days, third time a matter of days, and the 4th time I was in Vanderbilt for a week and then transferred to a nursing home for 3 weeks for rehab. During that last visit in rehab, I was on maximum dose of Oxycontin and oxycodone for that entire time. When I left, I was able to give it up because I had access to cannabis in a state where it was illegal and made me a criminal. I came to the state of Colorado because I was tired of being a criminal and I knew I had battles still to go. Being here in the last 2 years, I've had 6 surgeries, and I'm opiate-free. I think that anyone should be given the option. There's been a stipulation about the acute and the chronic. I understand acute to be a severe short-term, chronic, acute, severe long-term. If we can prescribe anyone, addiction doesn't have discrimination. somebody gets on opiates for a short time, they're still going to be an addict. And so we should give them the option. And I beg for you, there's so much that I'd like to share with you, but I just ask you to support this to give people's lives a chance, free of addiction, free of overdose. Thank you.
Thank you, Mr. Kenny. Next up, are you Katie Peterson?
My name is Mindy Meisinger.
Okay.
Hi, my name is Mindy Meisinger. I represent myself in Colorado Normal. Thank you for the opportunity to have my voice heard. I'm 39 years old, I'm a disabled mother of 2, and I'm a medical refugee from the state of Oklahoma. I've had 7 back surgeries from injuries I received during my 7-year career as a registered nurse. I herniated multiple discs in my lumbar spine, and that gave me severe chronic back pain, temporary paralysis, and neuropathy of the legs and the feet. To remedy my back injuries, I underwent several laminectomies, a bone graft fusion, and had pins and titanium rods placed in my spine. I had suffered from chronic back pain for over a decade, and during that time, a wide variety of pain management medications were prescribed me in the form of opiates, muscle relaxers, and benzodiazepines. Just to name a few of my prescription medications: morphine, Dilaudid, hydrocodone, oxycodone, Opana, Soma, Valium, Flexeril. My list is much longer, but I'll stop there. It will take an entire 2 minutes to read the list. My pain was intense, and I was desperate to reduce my opiate use. I even opted for a spinal cord stimulator in hopes of managing my back pain without pills. The spinal cord stimulator reduced my pain, but it did not address my addiction to opiates. My first attempt to get off the opiates, I attended a methadone clinic every day for an entire year. The result of the year of methadone treatment, I safely weaned off the opiates, but I required a daily low dose of methadone known as methadone maintenance to manage my opiate cravings, and my pain was still moderately present. Unfortunately, several months after completion of methadone treatment, I re-injured my spine and ended up back on opiates. By 2015, I weighed 260 pounds, my liver was enlarged, and I was seeing 5 different medical specialists and taking nearly 30 pills a day for the multitude of side effects and symptoms that I had acquired from my long-term use of opiates. The diseases I was diagnosed with included diabetes, cirrhosis, autoimmune disease, hypothyroidism, fibromyalgia, irritable bowel disease, urinary incontinence, depression, and anxiety. I was miserable, and I could barely function, and I was desperate for relief. After a near-death experience following a back surgery, and against all medical advice, I began illegally medicating with marijuana. The results were incredible. Within 3 months of marijuana use, I was able to wean off 80% of my prescribed medications, and by 6 months, I was off all of my pills. I have not taken any prescription drug medications for 3 years now. When I weaned off all the pharmaceuticals, my diseases seemingly went away. When my diseases went away, I didn't need to keep seeing the 5 medical specialists. I lost a total of 120 pounds the first year of no pills. For the past 2 years, all of my blood work, ultrasounds, and medical checkups have been clean and clear of diseases. I feel amazing now. I manage my own health with medical marijuana, a plant-based diet, and routine physical therapy. And now I'm training to appear as a contestant on American Ninja Warrior. Thank you for your time, and please vote yes on Bill 13.
Thank you so much. Please introduce yourself and who you represent, and then share your testimony.
Good afternoon, Madam Chair. Sean Coleman, representing Drug Policy Alliance on this particular legislation. I wasn't going to testify, but I wanted to clarify a few. Hope I can, in less than 3 minutes, clarify some of the questions that have been raised through the course of the testimony. First of all, Madam Chair, you did speak to a work group that was convened. That is correct, in the House by Representative Hooten, who is the House sponsor of this bill, and as well as representing several members of the patient community as well as the medical community. We do believe we have some language that is going to address some of the concerns that we heard today, so I'll set those aside. But to Senator Crowder's point specifically, certainly I agree with my colleague on that ad hoc committee that we will continue that discussion. But I do want to highlight that the legislature has already passed some protections for this. For example, those who were here might remember Jack's Law, which discusses the types of medical cannabis products students can use if they are in school. That law specifically prohibits those types of, and requires that those students are using non-smokable types of cannabis. So there is precedent for that already, and those protections already do exist in current law, thanks to Jack's Law. That was at least in the context of the school environment. And then I wanted to speak to some of the questions Senator Smallwood had, because I think that they go precisely to the heart of the bill, right? So what we're talking about is the process by which one can lawfully use medical cannabis, which is the ability to then have discussions with their doctor, if they are a veteran, to not lose their access to VA medical practice. So for those things to happen, the condition for which they are using medical cannabis must appear on either the constitutional or statutory registry. What this bill does, which is deficient in the current law, which is I think why the patient community has come out so strongly to bring this forward, is that, for example, dental surgery is not a qualifying condition. So if I want to use medical cannabis to recover from dental surgery, my dentist is not under the law allowed to even recommend me to go talk to a medical cannabis doctor to get that recommendation, because that would be unlawful. So what this does is it gives simply the medical community the opportunity, when it is indicated that your options are, yes, you may want to use this opioid for your recovery from this condition. You have the alternative, if it works for you, if I, your physician, think it's a good idea, and a medical marijuana specialist physician also thinks it's a good idea, to use medical cannabis as either an alternative or a supplement to that treatment. That is why this bill is necessary, because it allows patients the choice that, frankly, we did pass legislation in the state to allow folks that are on probation to continue the medical marijuana treatment. All this does is give someone who had the crime of perhaps they should have flossed a few more times the same ability to treat themselves with medical cannabis and avoid an opiate, or at least reduce that usage. So I hope that clarifies the need for this bill and what is deficient in current law, because, again, most people who would want to try that would be turned away because they don't have a qualifying condition.
Thank you. Members, do we have any questions? Seeing none, thank you for your testimony.
Could I say something to Senator Smallwood?
Sure, please, go ahead.
I hear you ask a lot about the difference between acute and chronic. I was a registered nurse for 7 years before everything bad happened to me. Their definition is an acute pain management thing is if it happened immediately within the last 7 to 10 days. And if that injury were to last longer than 3 months, it becomes chronic. And if that condition lasts 12 months, it becomes chronic enough to be called a disability. And that was the criteria they used to declare me disabled. It takes about a year to be declared disabled on a chronic condition, but anything over 3 months is usually considered chronic. In my particular case, I was on chronic meds, but I still re-injured. Even this last year, I re-injured, herniated 3 discs, and I got treatment with medical marijuana, so I didn't have to use opiates. I had a surgical procedure where they use so much less drugs. They're charging my insurance less. I'm having to pay less. I'm not getting those drugs in my system. One time, I opted to go ahead and allow it, and I was sick for 2 days afterwards because my body was trying to purge those chemicals out of my system. I did not need them. And
Okay.
I have quietly told people when I've gone into surgical procedures to please understand that I'm on medical cannabis and to not use opiates.
Thank you so much. Let's see, we still have a couple of folks left to go. Can I bring up David Wasserman and Ashley Weber? And anyone else who is interested in testifying, please identify yourself because we're almost towards the end of the list. Oh, we have 2 more sheets. Okay, and I guess we can bring up Pamela Jacobson. We have David, Ashley, and Pamela. Who'd like to go first? Would you like to go first? I'll go first. Oh, go for it. Introduce yourself, who you represent, and then share your testimony.
My name is Pamela Jacobson, and I'm here representing
I'm
myself.
sorry, we can't hear you.
Is that better? No.
Senator Smallwood, can you hear?
Closer.
That's
Is that
better.
My name is Pamela Jacobson, and I am also an American medical refugee relocated from the state of Mississippi to live in Colorado. And actually, I didn't come here for cannabis. I came here for doctors. And I support this bill because I understand what it's like before I was diagnosed. I'm a cancer survivor, and I know the pain that I experienced before I was actually diagnosed with cancer. And I was not able to work because of the pain. But until I was actually diagnosed with cancer, I didn't qualify for a medical marijuana card. So for a solid year, that put me in pain, but I didn't meet the qualifying conditions. And since my diagnosis with cancer, I was over-radiated, and I am scheduled to have my 91st surgery on February the 11th from effects of the radiation and the chemo. And so when I came here, I was taking 75 milligrams of fentanyl every day. I was on oxycodone. I lived pretty much in a haze. Since coming here, I have given up the fentanyl. I am no longer taking it. I haven't taken it in a year and a half now. I'm off of all the prescriptions that I was taking before I got here, except blood thinners. I do still take the blood thinners, but that is the only prescription I have to take out of 11 that I was taking when I came here 3 years ago. And so I support this bill because, like I say, I know what it's like to experience pain before you're actually diagnosed with a condition. So please support this bill.
Thank you so much for your testimony. Would you go next, please? Just identify your name, who you represent, and then share your testimony.
All right. Hi, Madam Chair and members of the council. My name is Ashley Weber, and I'm here representing Colorado NORML, which is the National Organization for the Reform of Marijuana Laws. I want to thank you all for your time today and hope you all are enjoying your new year. I'm here in support of this bill. Our organization supports adding this to the qualifying conditions to be treating with medical cannabis. Having access to cannabis in the pain management toolbox could be useful for our doctors and patients. This can be applied everywhere from chronic pain management, acute pain management, to surgical pain therapy and dental options. There are those who do need opiates, and we don't want this bill to be more restrictive for those. We see cannabis manage pain, and when cannabis is taken alongside the opiate prescriptions, research has shown to significantly reduce or completely eliminate opiates from the medical regimens altogether. The fact is, some people will need to be on opiates for the rest of their life, and that's the fact. We just have to face it. When patients are in treatment for pain and test positive for THC, they are kicked off the program, and we need to be aware of how this restrictive use of cannabis during this pain withdrawal is only going to send them into heroin addiction programs, and that's going to cause more problems that we're going to have to solve later on. I can talk about my personal story, but that would take a little bit longer. I just wanted to be here in support of this bill for the organization and show that pain can definitely be unexpected, and we need to have all options available. It's too late to maybe discuss with the legislators about "let doctors decide" motto for language this year, but it seems only necessary that we take the responsibility away from legislators deciding what medical ailments qualify for medical cannabis and put it into the hands of doctors. And hopefully that's an option to discover for next year's legislation. Thank you.
Thank you so very much for your testimony. Please introduce yourself, who you represent, and then share your testimony.
Hi, I'm Martha Montemayor. I'm a certified nutritional consultant. I'm the director of Cannabis Clinicians Colorado, a nonprofit professional society for doctors, nurses, caregivers, and others working directly with medical marijuana patients in Colorado. And I'd like to talk a bit about the difference between acute and chronic pain. And since people keep talking about the dentist, let's just keep that analogy. So if you have a tooth pulled yesterday and you are in pain today, you cannot get a medical marijuana card for that because it is acute pain, but it is not yet chronic. Now,
if this goes on and festers and you now have a dry socket and an infection and it's been 2 months, you now have chronic pain and we can write you a medical marijuana card. One of the goals of this is to start people with a combination of care. We always want our patients to do more for their health than just smoke pot. I mean, seriously, we want you to, exercise and diet and things like that as well, and combine this with conventional medicine. This gives us a chance to do that combination from the get-go, to start someone on a cannabis program at the same time that they're having an acute pain program, and to help them manage that. And the helping manage is an important part here. So I want you to know that, we don't just randomly give out medical marijuana certifications. Here is a copy for each one of you of our Cannabis Clinicians Colorado New Patient Success Guide for Medical Marijuana Patients. So you can see the type of information that we give to patients and know that, we're not just saying, hey, go smoke weed. We're really talking to them about all of their health and different ways to use it in concert with conventional medicine. Now, let's talk quickly. I have a minute left. So let's talk quickly here about pot smoking. I've been asked to talk about that. There's a lot of fear surrounding smoking. And, if you're over the age of 30, you grew up with smoking kills ads on television. And tobacco cigarettes absolutely do kill people, but no one has ever died from a marijuana overdose in the history of mankind. No one has gotten lung cancer from pot smoking. And there are measured dose ways to do this. One of the things people don't seem to realize, inhaled marijuana is the fastest way to get this medicine into your body. It gives you relief so quickly that it's actually a very low dose way of using marijuana. You use a lot less when you use inhaled because you feel it so quickly. So when you've had enough, you set the pipe down, back away slowly, and that's your dose. The bioavailability on inhaled marijuana is actually very low. 25% is lost in exhalation. If you're lighting it with a lighter, that's another 50%. So all that you really have available is between 15 and 25% of the original cannabinoids that are in the material. So it's also very low dosage. And the third thing is, with that ease of control is so much better than
You're going to need to wrap up.
Absolutely. With edibles, what happens is the liver converts the delta-9 THC to a metabolite called 11-hydroxy-THC. 11-hydroxy-THC is more psychoactive and more difficult to control. It's more unpredictable than delta-9. So when we start people on edibles, we tend to have more chaotic results than when we start them on regular pot smoking.
Thank you. Thank you. Next up, is it David?
Yes.
You, David?
Yes.
Okay. Please, David, introduce yourself, who you represent, and share your testimony with us.
I'd like to start off by thanking this committee, Madam Chair.
State your name, please.
My name is David Wasserman, and I am the legislative liaison for the Southern Colorado Cannabis Council.
Thank you.
Thank you for giving me this opportunity to speak and for your public service. Our organization started all the way back in 2009. We represent licensees, physicians, attorneys, patients, and all of the ancillary businesses. I sit before this committee not just as a representative of the Southern Colorado Cannabis Council, but as a patient as well. I am in favor of SB 19013, medical marijuana condition opiates prescribed for. I got diagnosed with Crohn's disease in 2009. Crohn's disease is a genetic autoimmune disease that has unfortunately controlled my life for years. I've had 2 surgeries and more than 3 feet of my stomach removed. In 2009, I was prescribed everything from Tylenol with codeine to the infamous oxycodone. I was 17 at the time. I ended up on opioids long term. I moved to Colorado in 2015, and I used cannabis to get off of the hydromorphone, or Dilaudid, that I was prescribed. If I could have been prescribed cannabis to begin with, that would have saved me 6 years of prescription opioid use. I don't take anything nowadays as I've been mostly in remission, but if I'm given the option of an oxy or an edible, I'd rather take the edible. The constipation, sedation, physical dependence, loss of effectiveness, drowsiness are all side effects that cannabis does not have, but opiates do. It takes 72 hours to get physically dependent on opioids. Cannabis is not physically addicting. I'm 27 years old, and I'm desensitized to death. through Facebook, I've seen posts about 3 different acquaintances of mine overdosing just this past week. Posts like, "Rest in peace, Abby," "Rest in peace, Christina," "My heart goes out to Mike's family," are an everyday thing to me now. Opioids are killing so many Americans, it has become an epidemic. Illinois passed similar legislation, Alternative to Opioids Act of 2018, for patients 21 and older. It allows them to purchase up to 2.5 ounces every 2 weeks and is valid for 90 days. It can be renewed if it has to be. The program actually started today. Chronic pain patients should be able to live a pain-free life. We deserve options. For many people, obtaining a medical marijuana card can be more difficult than getting a script for Vicodin. There's nothing worse than being unable to leave your bed or laying on the floor of the bathroom wishing for the pain to go away. I've always said I don't wish chronic pain on my worst enemy. As Coloradoans, we are fortunate enough to have options. Let's open up those options to all those who need some type of treatment. I would like to relay one more time that I am in favor of SB 19013, and I urge you to vote yes. Thank you for allowing me the time to speak.
Thank you. Members, do we have any questions of these witnesses? Seeing none, thank you for your testimony today. Next up, I would like to call Michelle Walker, Don Blackman, and Kevin Amelin, and Katie Peterson. Yes. Please introduce yourself, who you represent, and then share your testimony with us. Who would like to begin?
Hi, my name's Katie Peterson.
Okay.
And I'm here on behalf of myself and Americans for Safe Access.
A little louder and closer to the microphone.
I'm really nervous. I'm sorry. I am a recovering opiate addict. This plant was able to help me get off of fentanyl, and it saved my life. And people should have this option because I was hit by a drunk driver, and I had a rod I have a rod in my back, and I was prescribed a lot of things, and they helped for a little while until they didn't. And once they didn't, I really didn't have any other options, and I was really just at a loss. You know, a lot of the doctors I worked with, they weren't taught about the endocannabinoid system and were really restricted with what they were able to offer me because I was already on fentanyl. What do you give somebody when they're already on 100 micrograms of fentanyl and 30 other pills? You know, their hands were tied. And so I had a stroke and wasn't able to talk for 2 months, and just started writing down what I wanted if I was able to ever talk again. And started researching other things that I could do, things that they didn't know what caused the stroke. I started just researching things that might have caused the stroke. And a lot of the things that I found was that the side effects from the meds that I was on could have been a key factor. And I just started researching holistic medicine and plant meds. And a good friend of mine has grown industrially for a long time and turned me on to medical cannabis, and it saved my life. And I'm just one of many people I know, and I just appreciate you guys taking the time to even listen to anybody's stories because they are very personal. And when I came in here today, I thought how humiliating to talk about this in front of people. But hearing everybody and seeing how kind you guys are to everybody, just thank you. And know that this really does help a lot of people. So, yes, I'm in support of this, and thank you for listening.
Thank you so much. Please introduce yourself, who you represent, and share your testimony.
Hi, my name is Dawn Blackman. I'm representing myself as a medical marijuana patient, and I'm also hopefully representing people who aren't patients who need to be able to use this medicine for a short term. I am a medical marijuana patient, like I said. I was diagnosed with ulcerative colitis in 2010. I have been lucky because I voted for Amendment 20, so I was able to get on cannabis right away and manage my condition. But in June of 2017, I wound up with what's called a cecal volvulus, which basically means my intestines detached from my body, twisted up, and I was 2 days from death. I had emergency surgery. I was intubated in the hospital for 5 days. I had the little button that you could push, and I was terrified. Absolutely terrified, because that was the week when every 20 minutes it was on the news that somebody else was dead from an opiate overdose. And we know that most people get on these things because of acute pain, because they had an accident, because they had a fall. And I did not want to be that person. I absolutely did not want to be that person. So I asked the doctors at university, I'm like, hey, can I have a patch? Just let me have a CBD patch. Because I'm at university. I know the kids at Children's, there's kids like Alexis that are using cannabis for their epilepsy. So why can't I have a patch? And I'm a patient. They couldn't let me. I understand it's a teaching hospital. They had to follow the rules, but I was able to educate a lot of physicians and medical people that day on why this was going to be better for me. I could not wait to get home. I did not touch one single opioid once I left the hospital. Last August, I had another surgery to go back in after the first surgery for a double hernia, and I didn't even have opiates after surgery in the hospital. I had Tylenol and Motrin, and I used cannabis when I got home, and I never once touched an opiate. I never had to worry about being that person. I never had to worry about being my friends. These are my friends that are telling you these stories of their lives that through no fault of their own, whether it was a disease, whether it was an accident or whatever, that all of a sudden they're in this position where now they're an addict, now they have a problem, and that never had to happen for them. If they would have been able to have cannabis for a 2-week period, for a 90-day period, for however short amount of time, even a year, so what? It's a year. You have to go back, and if you don't need it anymore, you don't need it anymore. If you have cancer, you get over cancer, your card is done. It should be the same way for acute pain. Whether that acute pain runs into the 30 days, 90 days, 60 days, whatever it is, that's going to be different from everybody. Where's going to be that line for you or me, where now I'm addicted and it went from acute to chronic? We don't know for ourselves. So we need to make this available to anybody who needs it for that short amount of time, and they can go back to doing their opiates, or they can go, use it consecutively or not, or finish and just be done. But I really hope that you all will support this, because people really do need it, even for a little bit of time. Thank you.
Thank you. Please introduce yourself, who you represent, and then share your testimony.
Thank you, Madam Chair. My name is Michelle Walker, and I'm here representing Mothers Advocating Medical Marijuana for Autism, Safe Access Colorado, and my child. My son is a pediatric patient, and that's what I'm here to talk today about. I want to talk about a few things that have come up. I want to talk about doctors and why it's written a certain way in this bill, and also inhalation. So this language aligns with the Constitution, and it's very similar to the autism qualifying condition, which is the bill that I'm working on as well. Currently, the Constitution requires that pediatric patients see 2 doctors. These safeguards have been in Colorado for almost 19 years. No harm has been done to children. No harm has been done to doctors. The system works. This bill is written to align with the Constitution and to not restrict access to the patients that need it most. I have friends who've had CPS called on them, immigration called on them. Some have lost their homes because their primary physician does not agree with medical cannabis. My son's doctors, thankfully, have seen it change his life. However, they won't recommend it. They say, great, I'm so glad that Vincent's doing better, but I can't recommend that because then I can't accept Medicaid. I can't accept insurance. Or I just don't feel comfortable being a marijuana doctor, and I respect that. However, I can have them as part of my team, and this bill is written in a way that will ensure that pediatric patients and their families can maintain that relationship with their doctors. On the subject of inhalation, inhalation is the fastest delivery method available. We're not giving our kid bongs. We're not giving them joints. It's not what you would think it is. My son has a medical mask, so when my son starts seizing, we have a few different delivery methods we try, including a nasal spray. If it doesn't work, I'm going to get that medical mask, I'm going to place it over his nose, and it's going to stop his seizures in about 10 seconds. It's either that or I have to give my son Versed, which is anesthesia. I am allowed to give my son anesthesia at home, and then I have to call 911 immediately because it will stop his heart and his lungs. Inhalation is such a safer delivery method. Do we give our kids Versed or do we give them cannabis? Cannabis doesn't hurt him. In fact, it stops his seizures every single time. My son should be dead and he's not, and I'm able to be here with you today. So I implore you, please don't restrict these delivery methods. We are good parents. I know that there's a concern and I appreciate that, but we want to do the right thing for our children, and that includes giving them the safest options that will protect them. If you have any concerns about the pediatric aspect or the doctor aspect, please ask me any questions, and I will do my best to answer it as best as possible. Please ensure that the pediatric patients maintain their access. Our children are the most important people, and we need to stand by them. Please support this bill with no amendments. Thank you.
Thank you so much. Will you please introduce yourself, who you represent, and share your testimony?
Thank you, Madam Chairperson. My name is Kevin Aimling, and I represent the people of Colorado. And what I wanted to say today was that this bill specifically, I wanted to speak about the bill itself. All the testimony you've heard today has been outstanding and is my testimony too. I am a person who started off with acute pain and then steadily became chronic pain. Fast forward, 2012, I'm addicted physically to opiates, benzodiazepines, muscle relaxers, yet I am still depressed, suicidal, and still in pain. So basically my point is, cannabis was able for me to reduce almost 90% of my opiates, 100% of my benzodiazepines, 90% of my SSRIs, and 75% of another opioid called tramadol. I do not want anybody else in the state of Colorado to go through what I did. When I started this, I did not actually believe in medical cannabis. I was a recreational user. I believed it had no medical effect for a very, very long time. I've learned otherwise and have been educated, and I am my own personal testimony to the efficacy of cannabis. I'm not here to prove that to anybody else, but I am here to testify that the other people's stories are true and valid. In my particular case, and why this bill specifically should be looked into, is neuropathic pain was the pain condition that I suffered the most for, and opiates do not attack it almost for any patients. So I was completely wasted, drugged up, performing poorly at work, which I had a very high-risk financial position, managing financial risk for a large corporation. Yet I was, theoretically, I will say it, wasted. I was on drugs to a point where I honestly do not believe I was fully capable of performing my job duties. However, after the introduction of cannabis, I've been able to reduce my dosages. I am not a 100% success story, as we have heard here, but I am of sane mind now. I am of sane body. I cannot say anything other than cannabis saved my life and improved the quality of my life, and I know that we need to have this available as a safer option up front before any of these patients go down the road that I did, because I wish it upon nobody. Thank you for allowing me to testify.
Thank you for your testimony. Let's see if there's any questions from the committee members. Members, are there any questions? Seeing none, thank you for sharing your testimony with us today. Is there anyone else here who would like to testify? Please come forward. Is there anyone else? Please make your way to the front table here. Okay, thank you. Please introduce yourself, share if you're representing any organization, and then share your testimony.
Oh, there we go. There you go. My name is Dr. David Gordon. I'm here representing really myself, my family, and certainly for patients all around the state. I'm a board certified internal medicine doctor. I'm also board certified in integrative medicine. I've been practicing here in Denver for over 15 years after doing all my training at the University of Colorado. And really, for me, this bill is about prevention. We've certainly heard the stories of the trauma of opioid addiction and dependence. And for me, this is really about preventing the problem before it starts. We do a lot to Band-Aid problems after they occur, both in medicine and otherwise. And this is all about preventing things before they start. And really, again, opioids, we know they destroy lives and we know they destroy families. But, you know, what we don't really think about is how that process starts. So a 2014 study showed that 75% of heroin abusers got their start with a prescription opioid. And so really what we need to know is how do we stop that from happening? That number is probably higher now. That was a 2014 study. And much of that first opioid prescription comes after surgery, after a procedure, or after some new event where literally the doctor's toolbox is so depleted and it just has a few pharmaceuticals in it that an opioid gets prescribed. And what this bill does is it basically prevents that from happening, or at least it gives patients the option to not have that happen. And so that single opioid prescription can lead to opioid dependence and abuse problems. There's a study just a couple years ago, 2017 study, that looked at surgical patients who had never been given an opioid, never taken opioids before. Those who were given an opioid at discharge had a 15 times the rate of long-term opioid use and eventual dependence and problems. If you extrapolate that, you know, to all the patients having surgeries, these numbers are U.S. numbers. I can't speak to exactly what this would mean in Colorado, but that would mean about 1.6 million patients unnecessarily end up on long-term opioids just because they got that first prescription. And that leads to about 160,000 opioid abuses and deaths. So really, this is about giving patients options and control of their own health and having that first step be a broader conversation. You know, one of the things I just kind of want to comment on about some of the statements, and I'm happy to answer questions earlier, but you know, most physicians aren't educated in cannabinoid medicine. They don't take the time to learn about it. They just kind of follow propaganda they've been hearing for years. Unfortunately, most medical schools still don't teach this. So when this bill talks about having physicians, in a perfect world, ideally the patient's primary physician would be the one prescribing the cannabis. But if they're not willing to, that patient now no longer has access. And so that's one of the key tenets of this bill, is to give patients access and not force them down into opioid use. Again, happy to answer any other questions as well.
Thank you, Madam Chair. Just a point of clarification and stuff in your knowledge on this bill. I just want to clarify, because earlier in testimony there was a lot of statements regarding dentists being able to prescribe under this bill, and just looking for a point of clarification from either you or the sponsors that that would not apply under this, because it says two physicians.
I'd have to, sorry.
Senator Marble or Janal?
Thank you, Doctor. I question this too, because there are DMDs, dentists that are medical doctors, or that's their title after they got out of dental school. So I'm not sure on that. Senator Marble.
Senator Marble,
I'm not
is that
sure
your
if that covers
understanding?
dentists or not.
She's shaking her head no.
Say something?
Yeah.
My understanding is that it requires a medical doctor or an osteopathic physician to be the one writing the marijuana certification. I'd have to get 100% clarification on that, but that's my understanding. And so this is a situation where if someone's having a dental procedure, to use that example, if they just go to their regular doctor and say, I'm having this dental procedure, I don't want to take the Vicodin, can I get a marijuana certification? The doctor says no, they're forced to take the Vicodin and aren't given other options. So this gives them the ability to see a physician educated in cannabinoid medicine who can then give them guidelines, give them recommendations. And again, yes, there should be patient choice, and they have access to essentially all the products. But again, when you make something a medical condition based on the law, and then they go in and get that medical certification, yes, they're getting a tax benefit, and I'm sure there's value to that. But more importantly, they're getting education and guidance from a medical physician who knows how to use cannabis safely and effectively.
Thank you. Please introduce yourself and share any organizations you're representing, and then share your testimony.
Thank you, Madam Chair. My name is Isaac Kearns, and I'm representing myself and my family. On June 22nd, 2017, my stepsister, Tori Vickery, lost her life from overdosing to heroin at 23 years old. She had struggled with an opioid addiction for several years. To me and my family's knowledge, we don't know of any opioid prescription that she received besides dental work. I don't have a bunch of facts or anything like that to persuade you. All I know are these simple facts that we are in a state that we're lucky enough to see medical marijuana put to use in the chronic region, and it works. And we know that it works for pain. And we all know that this opioid crisis is the real thing and is way too easy to access everywhere. If we have an alternative right in front of us, why would we not automatically, no thought towards it, offer a substitution, an alternative to this epidemic that we're experiencing now? Thank you.
Thank you for sharing your testimony today. Please introduce yourself, who you represent, and share your testimony.
My name is Autumn Brooks. I'm speaking for myself and my family. I am been for years, my entire life, dealing with pain. I tried to go from doctor to doctor to try to solve it. I didn't want to get opiates, and that's all they were trying to give me. Instead, I spent years taking ibuprofen, maximum strength, and taking the amount that would be given after, say, I don't know, childbirth, 1,600 milligrams. So that was the only thing that I could do to manage my pain until a car accident in 2010. Finally, I ended up with migraines that were so severe that I had them every day, and all my other symptoms were intensified. I finally found out I had fibromyalgia, among other things that caused pain. And again, they were telling me I needed to take opioids. I can't take barbiturates because they kill me. I can't take various other things because I'm sensitive to medications. We've tried. I'm currently on medications that are eating my brain, and I am not taking cannabis for myself because I'm waiting until my son can get his card. He is autistic. So this bill is piggybacking off of the other bill that I'm also advocating for. We need these bills to pass because it will benefit both me and my son. Without it, we can't get it, and we can't save ourselves. It's not a miracle drug, we know, but it's a tool, and maybe we can get off of medications that are causing harm now. Thank you.
Thank you. Please introduce yourself.
My name is Daniela Espinel, and I'm here because I'm a patient. I'm supporting this law, and I'm also a mother of a patient.
Thank you.
We started a journey a few years ago with every single medication for different conditions, and no one, not even one doctor, talked about cannabis as a solving problem or any chance of light on any side of medication. I have been using cannabis for 5 years. My kid has been using cannabis as well for 5 years, and we have been away from hospitals almost for 3 years. This is not a miracle drug, but this is something that we need to attack, and we need to know that less than 13% of the doctors in the United States know about the endocannabinoid system. We have more research for cannabis than for Tylenol, and we are not using that in the way that we're supposed to. I really appreciate if you can pass that law because it helps a lot of mothers like me that were looking for that tiny little light that we can have for our future and for our kids. Thank you.
Thank you so very much. Committee members, any questions for these witnesses? Seeing none, thank you for sharing your testimony today. Make sure you sign the testimony sheet that's in front of you. So this is the final call. Is there anyone else out there that would like to testify on Senate Bill 13? Seeing none, we're going to close the testimony. Oh, we do have one. Please come forward. Please introduce yourself, who you represent, and your testimony, please.
Hi, I'm Marcy Cooper, and I'm a registered nurse, and I am representing patients. I just want to say I support this bill. I actually work with a lot of geriatric community patients in hospice, and you want me to start over? My name's Marcy Cooper. I'm a registered nurse. I'm here to represent myself and my patients. I do hospice nursing and work primarily with geriatric patients. I have a lot of patients that I encounter on hospice who have simply had something of an injury like falling and breaking their hip. These injuries are acute in nature. Hospice is not a qualifying condition right now in Colorado, so these patients do not have access, and most of these patients are not going to feel comfortable unless they know it's okay. When they get this card that says it's okay, that's when they will use it. So, that is one aspect that I look at when I think about acute versus chronic pain. Also, I have met several patients that have had things like skiing injuries even in their 70s, that they were healthy enough to do that. That is wonderful. But after they break their shoulder bones and their coccyx, they're laying in bed in a lot of pain. They have had no options. And I think this bill opens up the opportunity to provide options to patients that need more than just opioids. That's really all I wanted to share today, and I thank you for listening. Thank you.
Thank you. Last call. Is there anyone else out there that would like to testify on this bill? Seeing none, we're going to close the testimony phase. At this point, the bill is on the table for any action, and I do want to say that there's two suggestions that have come through with testimony. One was an amendment that was offered by us. I guess it's a stakeholder group that will address some of the concerns about children. And I know that this is a working group, but I was wondering your reaction in reference to including that. Are you considering that, or that would not be an option for consideration? Senator Marble.
Thank you, Madam Chair. Yes, I have been advised of that amendment. I agree with the amendment. I see it as a good thing and probably something that would already happen, but it just codifies it. It is having those records from the child's primary care doctor, follow them over to the medical marijuana physician. And so this has been something that has already been diagnosed by the primary care, and those records follow with it. And that's what we're doing, is just making sure that the medical marijuana doctor has those records. And we see that as, we kind of took for granted, I think, that would be what happened. But this will make sure that it does happen.
So you would consider that a friendly amendment?
Yes. Yes.
And what about this examples that we've been hearing about dentists? Several folks have come forward and they suggested that if the dentist prescribes an opiate, that dentist would not be eligible to then write a prescription for marijuana. Senator Janal.
Thank you, Madam Chair. And I do believe that's true, that dentists are not included because in the Constitution, as it's stated, it is 2 MDs or DOs would be equivalent to medical doctors as well. And so dentists are not included. And if we're sticking with the way we have it in the Constitution, then that is correct. Dentists are not included.
Okay. I am going to take a quick recess. I need to talk to the bill sponsors. Let's do a 5-minute recess, please.
What's up, Reefer Revolutionaries? Thanks for jumping in, and special shout out and a thanks to Alexis Bortell for hooking us up, letting us know that she was going to be testifying at this committee, and I was able to find their live audio stream coming out of the, and what are we listening to? We are listening to the Colorado General Assembly Senate Health and Human Services Committee testimony on SB 19013, SB 13, adding basically acute pain or anything. The way I read it is acute pain has been the discussion, really. But it's medical marijuana condition opiates prescribed for. Yoda, medical marijuana condition opiates prescribed for. So it's basically trying to expand the Colorado medical marijuana law. And we jumped in this because our friend of the show, Alexis Bortell, 13-year-old Reefer Revolutionary, cannabis warrior out there in Colorado, a medical refugee herself from Texas, opened up the testimony, and we just start. I mean, literally, they started it, or I caught her starting her testimony, and that's when I started broadcasting. So I'm going to replay Alexis's testimony once these guys are done. I don't know. I think they might actually be voting on this, or this is a committee. I think it has to go out to the House, the full floor, but it'll get passed on to the floor. So we are in a little 5-minute recess here. This has been the Colorado General Assembly Senate Health and Human Services Committee with some really compelling testimony, really amazing testimony, the vast majority of which in favor of passing this bill to add conditions, more conditions that opiates would be used for. The discussion being about amendments for the bill as written that would take up a couple of issues with regards to dentists being able to prescribe it, because that apparently is one of the ways that folks get messed up on the opiates, is through dental work, thus the acute pain issue. And the other amendment, of course, is to protect the children, because we don't want 9-year-olds getting their card just so they can spark up the reefer or a weed joint. So... Jennifer Schaefer, thank you very much for tuning in. And thanks, really big thanks to Alexis, who is not only out there testifying, pushing for medical cannabis for all of the medical refugees in Colorado and the rest of us around the world, the country, but also giving us a heads up here at Reefer Revolution that this is going on, and set me on my quest to find the stream for you guys. So thanks for joining in. Subscribe, get notifications for when we do go live. This was certainly last minute. Few things going on over in our neck of the woods, which I'm not going to necessarily discuss right now. But if you're a follower of the show, you know things are going on in many ways. So join us, tune in Sunday for Super Bowls Sunday. I don't know what's going on Sunday, really, quite frankly. Anyway. I don't want to get too into it because we're waiting for these guys to come back from recess, and I want to hear the rest of this because it's compelling. I didn't really think I was going to be on for much longer than Alexis's testimony, which is at the top of this broadcast. I picked it up just as Alexis was starting, and I'm going to replay it once these guys are done, but you can rewind if you want. Meanwhile, we're waiting for them to come back from this recess to discuss amendments. And pretty good. I mean, just some really amazing testimony. A couple of naysayers, a couple of folks saying the way the law is written is questionable. Doesn't do, leaves it too open for the kids that want to smoke the reefer. And it sounds like there's some issues with regards to just not wanting to pay your taxes. Because it is, of course, in the recreational market tax and regulate scheme out there. But cannabis is medicine, folks, no matter how much they're going to kick and scream in this tax and regulate legalization scheme nationwide, because that looks like the way it's going to go. It looks like the way we're going to be able to do this is to basically let corporate cannabis take over and let them get their money and let the tax man get his money. And then we have to try to protect patients like this. They're trying to protect patients in Colorado, getting patients more access. We've had a medical cannabis law in California, so of course, Prop 215 since the mid-90s. And Prop 64, our scheme out here in California, was supposed to protect the 215 patients And when they combined it with Maurkursa, and it became the new law, combining all of the medical with the recreational, the patients basically have been, left in the dust, in the wake, and trampled in the dirt, whatever you want to call it, in this rush to legalize. Quote, legalize.
The Senate
and we're
Health
back.
and Human Service Committee will come to order. Senate sponsors Janal and Marble. We have come back to order.
Okay.
At this time, I will be looking at laying the bill over till next week sometimes. But before we do that, it will be for action only because we've had tremendous testimony today. Thanks to everyone that showed up and shared your stories. They were all very touching, and I see the benefits for using medical marijuana. With that in mind, before we close out, I wanted to know if any of our committee members would like any closing statements, would like to make any closing statements as well as our bill sponsors. Senator Crowder.
Thank you, Madam Chair. I think with the amendments, I come in here liking the bill, and I think with the amendments, I'd even like it a little bit better. Thank you.
Further comment, Senator Winters.
Thank you, everyone, for coming and sharing your stories and the struggles that you've had with pain and addiction and how you came to be in this room. I very much appreciate it. The opioid crisis is something that we have to address, and I think this is one of those bills that helps us move forward, and I look forward to seeing the amendments next week.
Further comment, Senator Rodriguez.
Thank you, Madam Chair. Yes, I'd like to echo my sentiments to thank you for all the testimony that came out today. It was very inspiring, and listening to your stories, it helped me really understand some of the issues you're dealing with as somebody who hadn't dug into this issue much until today. I thank you all for giving me a lesson, so thank you guys all.
Thank you. Further comments? Seeing none, we're going to lay over Senate Bill 13 for action only. It'll be heard next week. Thank you. Our next bill will be Senate Bill 5, and once again, we'll have...
There you go, laid over till next week, where it will be heard, I'm assuming, on the floor. This is committee. So, Liberty is right. Alexis Bortell joining us in the chat. Thanks, Alexis. Awesome job. As a matter of fact, I'm going to replay your testimony, what I have of it. I got most of it. I think I just missed your intro. I'm going to replay that right now. I just want to say the last person that testified there was a hospice nurse. And I'm really glad that she made the mention that hospice is not on the Colorado list. And I'm not 100% sure it's on the California list either. And that's what's going on here, folks. In our home is cannabis is being used in hospice with mom. And that's where Chela is right now. And I never thought I'd think that the words actively dying would bring relief. But those are, strangely enough. But one thing that is also bringing relief in this active dying, quote, process is cannabis. CBD. Mom is on morphine. And CBD actually helps the body assimilate and use morphine. There's a little THC in there too. And it is definitely helping. Thanks, everybody. Something will happen on Sunday. Something will be here. We'll be here. I'll be here. Videos will be here. Something will be here. I have some videos to show you that we're cutting. We are still planning to lobby up in Sacramento next week. I thank you all for joining the show today for this very compelling testimony in Colorado. I'm going to play Alexis right now, who led off this broadcast and led off the testimony in the Colorado General Assembly. And let's listen to what Alexis had to say. I thank you all for joining today. Subscribe, get notifications, and thank you for supporting Reefer Revolution Live. And thank you, Alexis. All 13-year-olds should take your example. Here we go. Free the plant, free the people.
Access to cannabis, and today I am almost 4 years seizure-free thanks to cannabis.
Please, we have certain customs and decorum here, so no clapping is allowed.
Notice I didn't say CBD, and that's not a mistake. I use whole plant cannabis. So the question some of you may be asking yourself is, why is she here? People with epilepsy already have access to cannabis. In a way, that is part of my point. If you take away all the labels, product advertisement, trade shows, so-called experts, and tax policies and medical cannabis, then what's left? The answer is patients like me, our families, and our desire for relief, no matter what our condition is. Colorado law already states that cannabis can be recommended as a medicine by doctors. My point is that every patient should have equal access to every medicine our doctor thinks can improve our lives. I should never have better health care than other patients because a politician thinks I should, or because my illness makes me part of some chosen group or class. You've done your part. You've given our doctors legal access to a powerful and safe agriculture-based medicine that almost anyone can safely grow or buy. The rest is, and should be, on us Colorado citizens. Again, I support this bill, but I am asking all of you a bigger question. Do cannabis patients like me have equal liberties and freedoms to you? If so, I'm asking you to help me abolish the qualifying conditions list so our doctors can finally do their jobs and we cannabis patients and our families can focus on our recovery. Thank you.
Thank you for your testimony. Sir, would you like to introduce yourself, and then we'll do questions?
My name is Dean Bortell. I'm her father. I'm not testifying. She asked me to come up. If you have a question, I'd be happy to answer it, but I'm just here for her.
Thank you for supporting your daughter today. Committee, any questions? Seeing none, thank you for your testimony. Next.
access to cannabis, and today I am almost 4 years seizure-free thanks to cannabis.
Please, we have certain customs and decorum here, so no clapping is allowed.
Notice I didn't say CBD, and that's not a mistake. I use whole plant cannabis. So the question some of you may be asking yourself is, why is she here? People with epilepsy already have access to cannabis. In a way, that is part of my point. If you take away all the labels, product advertisement, trade shows, so-called experts, and tax policies and medical cannabis, then what's left? The answer is patients like me, our families, and our desire for relief, no matter what our condition is. Colorado law already states that cannabis can be recommended as a medicine by doctors. My point is that every patient should have equal access to every medicine our doctor thinks can improve our lives. I should never have better health care than other patients because a politician thinks I should, or because my illness makes me part of some chosen group or class. You've done your part. You've given our doctors legal access to a powerful and safe agriculture-based medicine that almost anyone can safely grow or buy. The rest is, and should be, on us Colorado citizens. Again, I support this bill, but I am asking all of you a bigger question. Do cannabis patients like me have equal liberties and freedoms to you? If so, I'm asking you to help me abolish the qualifying conditions list so our doctors can finally do their jobs and we cannabis patients and our families can focus on our recovery. Thank you.
Thank you for your testimony. Sir, would you like to introduce yourself, and then we'll do questions?
My name is Dean Bortell. I'm her father. I'm not testifying. She asked me to come up. If you have a question, I'd be happy to answer it, but I'm just here for her.
Thank you for supporting your daughter today.